Hello, Professor Osman.
Hello?
Professor, excessive weight and diabetes in men. Does it only affect appearance, or does it have a direct impact on sexual health? Could you enlighten us on this topic?
Yes, this is a very important, valuable question. As a cardiologist, I must first express that my perspective on weight is never related to aesthetics or personal appearance. There are many metabolic problems it causes, and the question you asked is actually a topic that is often neglected, overlooked, or unknown or uninteresting to many people. And it is a serious problem. Therefore, to answer in the way you asked, yes, obesity and diabetes, beyond being a problem from an aesthetic or visibility standpoint, unfortunately have very serious negative effects on male sexuality, just like many other metabolic disorders they cause.
Professor, does adipose tissue cause estrogen hormone production in men?
Yes, this is also a very valuable, special question. Estrogen is a hormone associated with women, and in postmenopausal women, estrogen secretion continues through subcutaneous fat tissue rather than through the ovaries. Therefore, in women, having a certain amount of body fat, as long as it is not excessive, and having some subcutaneous fat tissue is a very important support for the continuation of femininity, sexuality, and estrogen support. But if we consider this question from the perspective of men, the thickening of subcutaneous fat tissue, or the problem we call obesity, or the presence of diabetes can be a harbinger of a very serious disaster in men due to the fat tissue's capacity to produce estrogen.
Professor, the increase in estrogen hormone due to the increase in fat tissue in men is very interesting. It's an unusual piece of information. Could you provide us with a bit more explanation on this topic?
As I said at the beginning, estrogen is the most important hormone supporting femininity. With menopause, estrogen production in the ovaries decreases in women, but estrogen production continues in the fat tissue. The same mechanism is valid for men. Through the aromatase enzyme in fat tissue, the testosterone hormone is converted to estrogen in peripheral tissues. Therefore, unfortunately, when compared to women, they are unlucky in this regard. Consequently, the increase in fat tissue in men leads to the breakdown of testosterone in fat tissue through the aromatase enzyme and the production of estrogen. Therefore, we can say that this accelerates a process that leads to a decrease in male sexual power and the deterioration of certain metabolic parameters related to testosterone, which we call andropause, to the detriment of men.
Professor, could you elaborate a bit more on the effects of the decrease in testosterone hormone and the subsequent increase in estrogen hormone on men, particularly on their private lives?
Yes, I can very clearly and explicitly state that in scenarios associated with diabetes, metabolic syndrome, or obesity, men unfortunately experience significant disadvantage. When we look at scientific data, unfortunately, it is reported that there is a decrease in sexual function in men at a rate of 40 to 50%. In addition, a decrease in testosterone does not solely mean a decrease in sexual power. Just as estrogen is associated with menopause in women, a decrease in testosterone initiates a process in men that we call andropause, and along with this, your life energy decreases. It triggers a process where you may encounter problems such as bone thinning, muscle wasting, decreased concentration, and memory weakening.
Well, Professor, can losing weight reverse all this situation?
Yes, as we always express, losing weight is related to the problems we associate with your diabetes, the problems we associate with hypertension, or it could be sleep apnea, your main problem. In terms of many problems we associate with this, just as it ensures reversibility, similarly, the reduction of fat tissue will enable the indirect production mechanism we mentioned to reverse again, leading to an increase in testosterone blood levels as estrogen blood concentration decreases, indirectly increasing. Or we can say a relatively increased level supports these mentioned functional losses or some other metabolic disorders in this sense, and we can say it reverses them again.
Professor, so what should the treatment approach be for such patients? What path should a patient like this follow?
Now, of course, the easiest or cheapest approach in this regard, meaning a mentally cheap approach, is to immediately resort to medication treatments. And drug recommendations obtained from urologists may perhaps be the first choice. In this sense, there is a special group of drugs called phosphodiesterase enzyme inhibitors, and these drugs have become known by their brand name, so to speak. Therefore, while I leave the choice of medication entirely to the professional doctors in this field, as I mentioned, I am speaking from the perspective that concerns me. For a healthy life, whether it is about reversing certain sexual functions or reversing other metabolic problems, the main focus we need to pay attention to and concentrate on is weight control and returning to a healthy weight, regaining muscle strength and bone strength. If you regain muscle and bone strength by losing the excess weight we mentioned through weight control, the reduction of fat tissue that causes estrogen production, which you do not need at all, will mean that these losses we mentioned will be restored.
Thank you very much for the valuable information you provided, Professor.
I also thank you, and hopefully I wish our viewers healthy and beautiful days.